the 7 minutes, in short of time, you just straight away do 70 degree scope. You listen to the patient's voice and you perform 70 degree scope.
Halo, selamat pagi. Apa khabar?
So on voice assessment, the patient scores 3 on grammar assessment, mainly readiness. There's also some element of roughness, which is about 1 or 2.
Okay, 70 degree. 70. Kali ketiga. He said kali ketiga. Sudah 3 kali kena panggil.
Tapi kamu lah, bukan saya. Tak ingat.
Tak pernah.
Boleh buka mulut, okay. Relax saja, saya nak pegang lidah ya. Sorry ya. Direct laryngoscopy, there appears to be papillomatous lesion with punctuate telangiectasia on the bilateral false cords extending down to the true cords. Also, the view of the true cords has been obstructed from the lesion in the false cord. However, it does appear as if the vocal cords are mobile. There's no other masses which can be seen. Therefore, my diagnosis for this patient would be there's no pulling of saliva, sensation is also intact. Therefore, my diagnosis for this patient will be recurrent respiratory papillomatosis of the larynx.
Any differential?
My differentials for this patient would be C larynx. My other differentials
C larynx.
Yeah, would be.
When you say that there are no other masses can be seen, what kind of mass that you are expecting, or you want to?
I'm looking for any supraglottic cyst, any obvious white masses in the larynx to indicate malignancy. So in this case, it looks more like a benign lesion to me.
Okay, all right, good. Thank you. So, any question? You agree with his findings? Okay, he said there's a lobulated mass with punctate hemorrhage. Okay, but then when you say some punctate hemorrhage, not necessarily it cannot be carcinoma. Okay, because laryngeal carcinoma can also have similar features, similar appearance. Okay, yeah.
Sensation by using 70 degree scope, can we assess the laryngeal sensation?
I did mention laryngeal sensation tadi. So better not, don't mention about laryngeal sensation, okay? Because you're not testing. Thank you for pointing it out. Okay, you're not testing the laryngeal sensation. So you don't touch the vocal cords and all. Plus the patient is anesthetized. Okay, but you may say that maybe the sensation is reduced by evidence of pulling of saliva. Probably there's pulling of saliva at the hypopharynx. The reduced sensation is more if there's pulling of saliva at the base of tongue, the pharynx, rather than just at the hypopharynx. All those are telltale signs that this patient has reduced sensations. Any questions?
She say the victim is
So something that you cannot what do you call that comment. You may say macam Hadid cakap kan, the mass is lobulated obscuring the vocal cords. Therefore I can't comment on the vocal cords. But I could guess that the mobility looks normal based on a glimpse of mobility. Okay, but of course you can't comment whether there are any lesions or not on the vocal cord because the mass on the false cord obscuring the airway. Okay, ada soalan? Yes, Intan.
For larynx, if there's a sternotomy scar or any kind of cardiac surgery, do we need to expose, like mentioned with
Okay, so the question is, if the patient have any other scar, do you need to expose from the beginning? Remember, you only have 7 minutes. Okay, you only have 7 minutes. Not necessarily you would have vocal cord palsy. You may not have any findings on the scar on the neck, but no scar in the neck, and then oops, there is vocal cord palsy. So you want to now in your mind, what is the cause of the vocal cord palsy then? Because the diagnosis, not only the sign, secondary to what? Palsy to what? There's no neck mass, there's a neck scar. Okay, then you would say that, can I look at other area of surgical scar that may cause a vocal cord palsy? Like, example tanya, okay, you want to see at the here scar, thoracotomy scar, examiner kata, okay, don't bother, means tak ada. Tapi kalau ada, okay, go ahead. Alright? And if there are no findings at all, okay, you must think of differential diagnosis of vocal cord palsy when there are no signs to be found on the short case, during the short case. Okay? Thank you. Mr. Chu, Yon Tong. I remember your name. Okay? Alright? Thank you so